So the tale begins on a beautiful spring evening after work in Rochester, Minnesota, when I was out on a training run with my close friend and physician colleague, Mike Brennan. We were ruminating, as we often did on our runs, about all of the problems in healthcare I mentioned to you at the beginning of the talk. And perhaps invigorated by the endorphins that make running conducive to creativity, or perhaps it was the pints of Guinness we were looking forward to at the end of the run, we tossed around the concept that what was needed was a totally different approach to the problems in healthcare. What if we could create a laboratory, a living laboratory, like my basic lab, but where instead of studying cells and mice, we'd study how healthcare is and might ultimately be delivered to people? And what if, by this different approach, we might be able to discover new insights and develop novel models of care delivery that would have the potential to rectify some of the problems of the current healthcare delivery non-system? Implementation of the scientific method requires a number of important elements. It requires space, a laboratory for us to do our experiments in. It also requires expertise in a discipline. In my case, it happens to be epithelial cell biology, a discipline I learned at the Rockefeller University when I was a Mayo Foundation scholar. It requires skilled people. In my lab, the skilled people are physiologists, microscopists, and molecular biologists. We designed space. We put it directly in our outpatient building, and we organized the space in a way to facilitate a different way of thinking and to be able to design real-time experiments focused on how healthcare providers interact with patients. Now, in the early 20th century, the Mayo brothers often spoke about a union of forces, the idea that medicine was a profession of teams, all unified by the value that the needs of the patient come first. They believed in this concept so powerfully that they made it the cornerstone of their practice, and it remains the unique and defining characteristic of Mayo Clinic today, was to have diverse, smart, passionate, and committed people. People like all of you in the audience, that's why you're here. Risk takers who are uncomfortable with the status quo, change agents who want to do things differently, who remain inspired by the past, but focused on innovating for the future.